Hi, my name is Dr. Polly Gibson, and I'm here to talk with you about an important part of your care here. At a doctor's office, a nurse may take your temperature to see how you are feeling. But here, you will take surveys so that you and your therapist might know how you are feeling. You will do them every few weeks or so. Now we will hear from a patient about her experience taking these surveys.
When you are dealing with mental health issues, there is a commitment you need to make to yourself to be involved in your own care. And this happens to be an instrument or a tool that allows you to see more of how you're doing. It will give you a graph when you've finished off a test, for example, and you can see if you're cycling, if you're staying the same, and it gives you something to review with your provider. And it's just, for me, it's been a marvelous way of monitoring how I'm doing. Especially I like the graphing a lot because it does help me see that I'm making progress, or if I'm not making progress, what do I need to be reviewing with the people that I deal with at the clinic.
Hello, I'm going to show you the mStrides application. This is where you'll be able to complete your questionnaires. mStrides can be accessed online at www.mstrides.org on any device, smartphone, tablet, or computer. Once you log into mStrides with your account info you were originally given, you'll be able to create your own login and password to make it easy to remember. You will be able to enter hints and reminders to help you unlock your account if you ever forget your password. You should enter your email address so that we can remind you to complete your questionnaires. mStrides data is more useful if you take your questionnaires regularly. When you first log into mStrides, you will be shown an agreement screen. This screen talks about how your information is used to track your progress. You should know that mStrides data is part of your medical record and is treated with the same care, privacy, and security, and may be used like any other part of your medical record. Once you have read the agreement, click Agree, and then Submit when you are ready. You will then be taken to a list of your questionnaires. To start one, just click Take Questionnaire. Make sure to read the instructions before you answer anything. Remember, there are no wrong answers, and if you need help, talk to your mStrides coordinator or healthcare provider. When you are done, just click Finished. When you complete a questionnaire, you'll see a graph of your scores and interpretations of that information. Once you've reviewed the information, click Home to return to your questionnaires. Repeat this process for each questionnaire, and when you have completed them all, make sure you log off. You should know that if you are a parent of a patient and you need to complete a questionnaire, you should do that under your own login. These questionnaires are a tool to be used by you and your provider to help improve the quality of your care. Please complete the questionnaires regularly to ensure these tools remain useful. If you have an emergency, please call 911 or your healthcare provider. Do not use mStrides to communicate urgent medical issues. Thanks for watching. If you have any questions or concerns, you may also use the following email address. If you are in the Rachel Upjohn building, brochures are available in the mStrides coordinator's office.